The COVID-19 pandemic has laid bare many vulnerabilities in the United States healthcare system, including a worsening shortage of nurses and physicians. But recent data indicates a new surge of interest in nursing, medical, and other health-related career programs. Stephanie Sy has this report for our series, Rethinking College.
Good girl.
At 55, Debbie Kinder is taking a new path. Last year, the mother of two, plus dog Diva, was semi-retired and working a part-time job. Then the pandemic hit, and she was laid off. Sheltered at home, Kinder saw a gap that needed filling.
I'm gonna cry. I kept seeing the nurses on the news, and they were like sitting in the hallways, and they were just like crying, and they were exhausted, and I don't know, I was just like really driven to go see if I could help in any way.
So she started training to become a licensed practical nurse.
This is Debbie, how may I help you?
And got a full-time job at a local home hospice. When she finishes her program in December, Kinder will take more courses to become a registered nurse or RN, a role with more responsibility and pay. Full-time school on top of full-time work is no easy task, but Kinder says she's prepared for the long road ahead.
What else do you think it takes to be a frontline worker during a pandemic? Because
Endurance.
we're still in it. Endurance.
I definitely have the endurance. I've done 3 Ironman, I've done an ultra run, and so I think that gives you the stamina. I'm not fast, but I never stop.
First thing you do is assess.
Kinder is part of a new trend. Last year saw record interest for many health-related programs nationwide. Medical schools saw applications soar by about 18%. Public health programs reported spikes in interest for both undergraduate and postgraduate courses. And Kinder's school, Gateway Community College in Phoenix, Arizona, saw a 15% rise in interest for its licensed practical nurse and nursing assistant programs.
They really want to help people, and they want to make a difference, and they feel that this is the way to do it.
Margie Schultz is the director of nursing at Gateway.
A lot of students have cared for their family members who had COVID, and some of them were extremely ill, and they realized they weren't scared by it. Or if they did home care, they liked it, and they were drawn to that.
She says that some applicants are also attracted to the field because of the high demand for nurses at all levels.
There are more jobs than there are people to fill them.
The unprecedented interest that schools like Gateway saw last year has been dubbed the Fauci effect, after prominent physician Dr. Anthony Fauci, who along with other frontline healthcare workers emerged as heroes during the pandemic.
For focus.
Ning Lien and her fellow classmates are some of the lucky few accepted to the University at Buffalo's medical school from a record number of applicants. Last year, the school saw a 40% surge.
During the midst of the pandemic, I had to focus on just getting by day and the tests at hand.
Lien had been working as a medical scribe, assisting doctors at a hospital in Brooklyn. When New York City became the U.S. epicenter of the pandemic, she felt powerless.
I was very disappointed in myself, not knowing enough to help anyone. So going through medical school will allow me to directly participate in patient cares.
She had worked on her medical school applications for 2 years and was ecstatic when she found out she was accepted.
That was incredible. It was an incredible feeling.
It's used by our 3rd and 4th year medical students.
Dr. Dory Marshall is the director of admissions at the University at Buffalo's medical school. She says that, like Lien, many first-year students were inspired by frontline doctors, but didn't apply on the spur of the moment.
It's really a process that takes years to get themselves ready to apply to medical school.
She says last year's spike in applications is more likely attributable to other reasons, like moving the entire process, including interviews, online.
The expense of flying here was gone with COVID. There was no overnight in a hotel. There was no travel expenses. The only expenses last year were really the application and then taking an hour for each of the 2 interviews. So I think that had a lot to do with it.
Fully online applications meant aspiring doctors could afford to apply for more medical schools.
Being able to do it virtually and at home saved me quite a bit of money so that I can actually use those money to apply to more school.
These changes meant University at Buffalo saw a 59% increase in applications from first-generation college students, like Lian, who moved to the U.S. from a village in China when she was 13. But this rising interest won't mean more physicians anytime soon. Medical schools and hospitals have not increased class sizes and residency programs to meet demand. Back in Arizona, Gateway Community College has enrolled more nursing students, but students need hospital experience to complete their training, and those spots, as with physician residencies, are limited.
Go ahead and tap your fingers.
While students can practice in simulations like this one, it's no substitute for the real thing, says nursing director Margie Schultz.
You absolutely must get in there with real patients, and patients do different things than a simulator does, and you really have to be vomited on, and you have to really experience it up close and personal to be a nurse.
Student Debbie Kinder is eager to join the fray.
What most excites you about the prospect of being an RN?
Being done with school. I think just that, honestly, I hate to say it, but that feeling of accomplishment of doing something I didn't think I was able to do, and then being able to help patients and interact with them and get that quality time.
She's got the bedside manner part down. For the PBS NewsHour, I'm Stephanie Sy in Phoenix.